Hi, my name is William Quinn, and I'm a student here at MUW in the RN Medicine program. Today we're going to be talking about the national opioid crisis. Today I have Marley, Katie, Hunter, Madison, and Sybil. They are all RNs who work at RN. Alright, so our objectives for this presentation. By the end of this presentation, the learner will know what the opioid crisis is. They will learn when the opioid crisis occurred. They will learn more statistics and facts about the opioid crisis. They'll be able to understand how the opioid crisis affects us in the healthcare industry. And they'll be able to recognize signs and symptoms of opioid dependency. And lastly, they'll learn how to make a difference, or we can make a difference in the opioid crisis. So first off, we're going to start off talking about what the national opioid crisis is. So the national opioid crisis, or the opioid epidemic, is a term that refers to the rapid increase in the use of both prescription and non-prescription opioid drugs. Opioids are a diverse class of moderately strong painkillers. Some examples of those are oxycodone, hydrocodone, heroin, and fentanyl, among other drugs. The opioid crisis is said to have begun in the 1990s. The increase of opioid overdose death has been dramatic over the past few years. It has risen just a whole lot. So now we're going to talk about how this happened. Well, in the late 90s, pharmaceutical companies reassured that patients would not become addicted to opioid pain relievers. This was before they had tested all of them out. So they told the doctors this. This led to more healthcare providers prescribing the opioids to patients with pain. Well, subsequently, this led to a widespread diversion and misuse of opioids. And when it became clear that these medications were highly addictive, it was already too late. Many patients were already hooked on the opioid, the pain relievers. Next, we're going to talk about some statistics. In 2017, opioids were responsible for 47,600 of the 70,200 overdose deaths in the United States. Drug overdoses have become the leading cause of death in Americans under 50. In 2016 alone, the crisis decreased the overall life expectancy for Americans. And every day, more than 130 people in the U.S. die after overdosing on opioids of some type. Some more statistics: roughly 21 to 29% of patients that are prescribed opioids for chronic pain misuse them. Another 8 to 12% develop an opioid use disorder. An estimated 4 to 6% who use prescription opioids transition to heroin. Heroin can be accessed easier. You can get on the streets, and it's also cheaper for those patients who don't necessarily have the funds or can get another prescription of their opioids. About 80% of the people who use heroin first misuse prescription opioids. That goes back to it's cheaper to get heroin, it's easier to get access, and some say it gets a better high. Some more statistics. Opioid overdoses increased 30% from July 2016 through September of 2017 in 45 states. The Midwestern region saw opioid overdoses increase the most, at an alarming 70%. And opioid overdoses in larger cities increased by 54% in 16 states over that same time period, from July of 2016 to September of 2017. Here's the impact on the healthcare industry. So the impact has been very dramatic. It overloads our emergency system, such as like your EMTs, your medics, your ambulance drivers, and even the ambulance in general, because it increases the calls for the overdose incidents. So this means while they're out treating an overdose incidents or stabilizing the overdose patients, if they say you work at like a small rural hospital, you're limited on the amount of ambulances you have. This can limit the care you can give, because if that patient calls, they have a heart attack, a stroke, or another medical emergency, they may be out already on the call, so it delays the time that they get to them, which, as we all know, is crucial in healthcare. It also results in more patients in the hospital, so it increases the cost for that hospital and limits open rooms for other patients, say when your staffing gets full. And in turn, this results in higher insurance costs to cover the impact on medical resources. Some signs and symptoms of opioid abuse, but this can go for both healthcare workers and non-healthcare workers. So some behavioral symptoms is the inability to control the opioid use, even when the user knows it is having negative effects on their lives. So they know they have a problem, they know they're getting addicted to them, but they can't stop because their pain is worse, they become used to taking the opioids. Kind of relating back to that, they can have unsuccessful attempts to decrease the amount of opioids taken. Some psychological symptoms are increased anxiety, depression, and lowered motivation. They may use the opioids to treat the anxiety, the depression, or the motivation also. That can increase their uses of the opioids. And some way healthcare professionals like us can make a difference. So before prescribing, we can screen the patient for high-risk conditions that may be exacerbated by the opioids. So this can come back to any kind of respiratory comorbidity, such as like COPD, sleep apnea, anything like that, because we know opioids kind of exacerbate that. So this can lead to worsened problems and sometimes even fatalities. Next, we can develop and follow pain management clinical pathway protocols. So here at our hospital, our pain management pathway protocol, we're taught to use like PO medicine by mouth first. Next, we use IM and IV usage last because it is evidence research has shown that IV usage of opioids and other pain medicines can lead to its higher increase on the dependency compared to just a pain pill. Next, we can discuss and see if other treatment options are available for those patients. So if we need to refer them to physical therapy, if we need to use like guided imagery, if we need to use guided imagery, distraction, any other treatment like that, we can use those instead of just straight, first off, prescribing the pain medicine, the opioids. Another way we can just start by evaluating the reason or reasons that they are on the use of the prescribed narcotics they have. Sometimes they have valuable reasons, or sometimes they don't. Like, say you have an elderly person, they've been getting this pain medicine prescribed for such reason, and they just take it like they take their other medicines every day. They don't really realize what they're taking. They just take it because, and this can lead to dependency. So sometimes it just takes us sitting down and verifying those medicines and why they're on them can help cut back on the use of prescribed narcotics or opioids. Also, we can educate the families on opioid use and addiction signs and symptoms. This refers back to earlier, we talked about the signs and symptoms. We can educate them on those and what an actual opioid use and addiction looks like as we've been in this PowerPoint. And lastly, we can offer referrals to specialized clinics. If we know they have an opioid addiction problem, if the patient knows that, we can refer them out to special clinics. They can get them the help, probably more help than we can here in the hospital. Also, if they want to go for like a detox, like one of the camps or something, we can refer them to that too and help them get over their problem. And that concludes our presentation. Thank you.